Just testing it.
Good morning. This is Kelly Sheets. I am your host for today's meeting. I want to apologize for the Zoom mix-up. Zoom has been a thorn in our side for the last few months, and I will also apologize because it is messing with my ability to see who all is here. But I believe right now it is 10:30, and I believe we have Susan, Hanlon, and Tudis. Have I missed anyone?
I think that's all of us for today.
Okay, great. Well, that does give you a quorum. So, Hanlon, I'll turn it over to you.
Okay. Good morning, everybody. We'll start with the introductions of the TAC members. I'll start. I'm Aylin Purden with Hazelwood Home Health.
I'll go next. This is Susan Stewart with Appalachian Regional Healthcare.
With this for Health Department.
Thank you. Okay, on to the minutes of the last meeting. That was the August 30th meeting. If the TAC members have had a chance to review those. I only saw one small error and it's on page 24. It says 22-24 where it should be 2024, but other than that, I didn't see anything. I'll make a motion to approve the minutes.
I can reach out to the court reporter and have that corrected if you would like.
Yeah, that's fine. Thank you.
And I'll second.
All right, all in favor? Aye. Did we get Tudis?
Aye.
Okay. All right. On to the old business. Guess we'll start with the EVV updates.
Good morning, everyone. My name is Laura Presley. I'm with DMS. I'll be giving you your update this morning. For EVV, hard edits are beginning January 1st, 2025 for EVV. Just a reminder, agencies will not be paid if there is not a corresponding visit to that claim. This team is reaching out to agencies today to make sure that there's no questions or if they're having any issues, but that's our update for EVV.
I do have a question.
Sure.
So on the signatures, do those actually start January 1 for the hard edit on those also?
Let me double check on that. Kelly, if you'll put that as an action item and I'll get that answer for you today.
Okay, thank you. Because I've tried to read, we've got training tomorrow, so we're going to try to have all the signatures up and ready. But like I read one thing and it said December 18th. So I didn't know if that's just when DMS wanted us to at least try to have the majority of ours started, or if that was a hard edit for that, or if I wasn't sure.
Right. I will get you that answer today.
Okay, thank you. Does any of the other members have any questions about EVV?
I don't.
Okay. And moving on, B is update on the supply fee schedule. I think I was trying to look back. That is that about the Chlorex drains and getting the update on those codes? And I believe at the last meeting, they said they were working on that.
Yeah, and the fee schedule recommendations, that includes other state analysis comparisons, is with leadership right now. I'm sure there will most likely be a cost analysis to go along with that, but it has been submitted for review.
Okay. And next one is supply limits. I believe that's for the MCOs.
That I'm not sure on. Kelly, can you take that back as another action item for us? I'm not sure if we have Jeremy on today to speak to that.
And I believe Aaron was actually going to be working on that when we had spoke to her. So, okay, so we're going to move that to next.
We clarify what that topic is about, supplies limits?
It's on like some of the MCOs have different limits than what the state does. And we've had a hard time getting what those actual limits are.
I
So we
see.
kind of play a guessing game. If we give 20 sterile galls, that maybe only 10 is paid, and then you have to rebill and keep lowering your amount till you find what it is that the MCOs will pay.
Got it. Okay.
Thank you.
Make sure that gets taken to the next meeting.
Okay, the next one is the reimbursement rates. There's a status on that request.
And is that for MCO, traditional Medicaid?
I think it was for traditional Medicaid, and then most MCO contracts are for the Medicaid state rate.
Okay, I do not have an update for that, so we will get you that information as well, get you an update on that as well.
We'll move on to new business. Credentialing. I believe that is where many providers haven't had their every 3-year audit. And I think somebody was gonna check with licensure to see how far behind they are on that. Oh, and I do know also that it was some providers are getting their Medicaid provider numbers as expired because of that.
Do you know who that was, Aitlin? Was that maybe Jennifer Dudinsky? That was going
Um,
to check on that?
I know we had spoken to Erin about it, and I'm not sure if Susan has. Looks like she's got something going on right now, but I think maybe it was some of her provider numbers that expired.
Okay, I think Jennifer is just joining. We could check with her to see if that was something that she had on her radar.
I'm sorry, I've got a surveyor at one of my locations, so, and today's my first day back from the flu. So I'm a little discombobulated. And what was the question, Anlin?
And was it you that had some of your provider numbers expired because of the revalidation and not being credentialed?
Yes, yes. And, you know, it's just a delay. And off the top of my head, I can tell you I don't have anything specific. I can get specifics and send it to somebody if I need to, but as of this moment, I'm not really prepared to talk on that.
Okay, maybe. And we had spoken to Erin about it, right?
Yes, we did.
And she was gonna check into it, so. Yeah, maybe y'all
Okay.
can put that as an action item to see where.
Sure, I'll follow up with Erin and we'll get you the information. And Susan, if you want to send an email to Erin and copy me, we will get that information.
All right, thank you so much.
Okay, so the next one was the MCO data for home health aid utilization. Or actually, I think it is the like what the utilization of home health aid was prior to the MCOs and compared to what it is now.
Okay, since that is a new business item, the MCOs could take that back and provide that information to you at next meeting. Just let us know how you would like that presented. Do you want like a 2 or 3 minute PowerPoint, or just let us know how you would like that presented and they can do that at the next meeting.
Okay, I think it's just, we would like the numbers of when it was just traditional Medicaid, how many aid visits were made, or I guess and be billed, and then what it is now for the MCOs. So I don't know if it's actually a presentation or if they could just get us the numbers.
So just to clarify, so you're wanting to know home health aid utilization before the MCOs were involved
Yes.
and home health aid
Yes.
information utilization once the MCOs involved. Would KDMS, wouldn't that be something you all would have from a holistic perspective?
Yeah, this is Stewart of Wellcare. That's what I was thinking. DMS should have that data. They have the codes and
Yeah, we wouldn't know pre-MCO.
And Kelly, that's something that we can ask our analysts to look at to see if they can pull that data for the next meeting.
Absolutely. Thank you, Laura. I will give that to Aaron as an action item.
Thank you. All right, so I guess we're to general discussion. Any updates from the MCOs?
This is Herb with Humana. Nothing new on our side. We're still on target for the go live for the EVV and looking forward to that being a smooth process.
Thank you.
yeah, and this is Stewart from Wellcare. Similar report. We're ready for go live. We've had provider relations do outreach to providers that are been struggling, but overall, most providers have demonstrated that they're ready, during the trial period. And also we don't have any kind of PA issues or billing issues that we're aware of at this time.
I'll just call out, any representative with Aetna? No. Melina? Anthem representative?
Hi, this is Kathleen. Can you hear me okay?
Yes.
Okay, I'm from Anthem, and I did, as you all may well know, that Anthem will no longer provide Medicare coverage in Kentucky starting January the 1st, 2025. And starting with that date and forward, the member's new MCO will handle new authorization requests. Membership is being assigned to United Healthcare and Humana, and the MCOs can be identified in the Kentucky Health Net as they are already assigned. It's been a pleasure working with you all, and we wish you all the best in the new year.
Thank you, Kathleen. Actually, that is a good question, and I had it written down here. So when we checked the other day on chemists for some of our current Anthem patients, we did not see the new MCO listed in there. So should they be in there now?
Yes, we understand they should be. If we identify it, we're notifying DMS to let them know if the member was not assigned. If you want to reach out, I'm not sure who you would contact. So they're Anthem members, or are they that?
Yeah, the ones I was printing, and it was like last week. They're Anthem medicated.
Yes,
When we ran them in chemists, it didn't show. Will it show in the Anthem system who the new one is, or no?
No, you'd have to go to Kentucky Health Net. Is that where you went to view? Okay.
Yes. Yeah.
Okay.
I'll have them run them again today just to check.
Okay. They should be assigned. Okay. And if you, and I'll have to check. Holly, any ideas on who they would reach out to?
No, I'm not sure who at the state that they should contact.
Wondering if you send it to us through regulatory, and then we can look into it and respond.
Okay. Well, my next step was going to be, if they weren't in there this week, we were just going to call the patient and see if they had received a letter and who they were with. So.
All right. Thank you.
Thank you. Have we done United Health?
Hi, this is Jayati from United Health. Can you hear me okay?
Yes.
Okay. Yeah, we are ready to go live for EVV hard go live on 1/1/25. We are fully ready about that too.
I think, unless we didn't get Melina. All right. Any DMS updates?
Just that our main focus right now is on rates and EVV. So that's the only updates from us.
Thank you. And any commissioner updates?
I don't believe so.
Okay. All right. I don't, unless any of the other members, I don't think we have any recommendations for this meeting.
And Lynn, did we
Yeah.
talk about the MCO, the data on aid utilization? I'm sorry,
Yes,
is that
DMS.
an official recommendation?
Oh, guess we can make it one.
Okay.
We'll gather the information, the data. You do not have to make it a recommendation if you don't want to.
I'm sorry, I didn't hear that. I was gagging.
No, I'm sorry. I've got a terrible voice.
Welcome to the crowd.
Yeah. Well, I've had mine since June, so there you go. But anyway, I was just saying that is not necessary to put in a recommendation. You can just make a request, which you already have, and we will do that data request for you and provide that to you.
Okay, all right, thank you.
You're
Sorry.
welcome. No problem.
Now I believe Susan, she will, if she's still alive, she'll be at the next MAC meeting. It looks like she survived the flu.
I'm on the, supposedly I'm on the going up, the 102 fever for 5 days is a little excessive.
Well, it's been going around. Everybody in my family's had it. I told them not to give it to me. All right. Well, if there's nothing else, I believe our next meeting is February the 11th. Unless anybody has any other questions or concerns. All righty, I'll make
Thank you.
a motion to adjourn.
I'll second.
All righty. Thank you, everyone.
Thank you.
Y'all have a good day.
Thank
You
you. You
too.
too.